Good evening. My name is María del Carmen Alba, and I am greeting you from Mexico City. I am founder and CEO of Instituto IRMA, which is a non-profit social aid institution with 20 years of experience in therapeutic accompaniment to women, men, and family members who have experienced one or more gestational losses of any kind, whether induced or involuntary, and at any stage of pregnancy. We have served more than 9,000 people in Mexico. We are a pioneer institution in Latin America in the care of all types of gestational losses. This has led us to train, research, and disseminate as part of our work. I am pleased to share with you at this World Conference on Perinatal Mental Health the major findings of our research, which have been already published in the scientific field and carried out in conjunction with my colleagues at IRMA, María Esther Cardoso and María Teresa Zavala. Depression and post-traumatic stress in women with induced and involuntary gestational losses. We decided to do this research first to improve the care of our patients, and second, to analyze in a comparative way in the Mexican population the effects of both types of losses on maternal mental health, since in general there is scarce research on the matter, and in Mexico there are no descriptive data to contribute to this discussion. The purpose of the study was to evaluate and compare the appearance of depressive and post-traumatic stress disorders in women after an induced or involuntary gestational loss who request psychological care at our institute. For the purpose of this research, miscarriage and fetal death is included within involuntary loss. The study was carried out with a convenient sample of 287 women from Mexico City metropolitan area who were treated at our institute between 2013 and 2016. 201 women out of this sample had experienced induced loss and 86 involuntary loss. The mean age was 29.9 years old. For our assessment, we used the Center for Epidemiological Studies Depression Scale, the Beck Depression Inventory, the Davidson Trauma Scale, and the Post-Traumatic Stress Disorder Symptom Severe Scale. The correlations between the instruments show there is comorbidity of depression disorder and post-traumatic stress disorder, mainly when an induced loss has been experienced. We also found that women who experienced a gestational loss and who reported post-traumatic stress disorder symptoms exclusively associate this with this trauma, whether induced, involuntary, or both. Evidence shows that experiencing an induced or involuntary gestational loss can be very stressful and triggers in women a response that can lead to the development of post-traumatic stress disorder in comorbidity with a depressive disorder, which is aggravated in cases of induced losses, because these women are more likely to present more serious or severe depressive states than in cases of involuntary losses. Similar results have been reported in the literature for gestational losses. The major finding of the results obtained in the post-traumatic stress disorder symptoms scale, 61.2% of women with induced loss present post-traumatic stress disorder. 53.73% consider the induced loss as the cause or one of the causes of the disorder, of 9.95% attributed to other traumas. Regarding depressive disorder, significantly higher scores were found in the Beck test, observing severe depression in 42.90% in women with induced losses, against 25.58% in women with spontaneous losses in our sample. The results confirm that both induced and involuntary gestational losses can cause severe post-traumatic stress disorder, and women with induced losses can present significantly more severe depressive states than those with involuntary losses. These findings deserve a broader and deeper interdisciplinary discussion in forums like this. However, we know that our time frame is short and that this particular way of sharing research has no precedence. Therefore, we are only highlighting some aspects we consider relevant for a further discussion that we hope can continue beyond this transmission. First, regarding the sample size, we consider it necessary to expand it in Mexico and also to invite researchers from other Latin American countries to use the same instruments and methodology in a regional study that will allow us to carry out at the same time a comparative analysis and have descriptive data for our region. Second, the need to continue making joint analysis of the implication of both types of gestational losses on the mother's mental health. We also consider that it would be important to include in future research the impact of both losses on the father's mental health, since this aspect practically passes unnoticed, at least in the Latin American region. Third, going back to the major finding of our research, we didn't find surprising that women with induced losses present more severe depressive states than women with involuntary losses. However, it was surprising not to find significant differences regarding post-traumatic disorders between the group of women with induced gestational loss and that with involuntary gestational loss, since both groups of women experienced it intensively. In the clinical setting, induced and involuntary gestational losses generally tend to be studied and treated separately. The result of this research suggests that perhaps this binary distinction could be in some sense reviewed in future research and clinical practice. Last, as an institution specialized in gestational losses with 20 years of experience, this research gives us a reason to continue committing to assist in dealing with the emotional pain of those who experience an induced or involuntary gestational loss. This pain needs to be addressed and recognized, not only by the person who lives it, the mother, the father, but also by us as a global community of people dedicated to research, policy making, and clinical care. The fact that we are gathered here today in this interdisciplinary conference is because we acknowledge that the conception of a human being has an impact on all dimensions of life, including mental health of the mother and the father of this human being, since this filial bond is indestructible. In conclusion, we believe that this study opens a new line of research. You can download it on our website. Also, will we be happy to continue the dialogue and academic discussion with you, and we'll answer all your requests in this meeting. Thank you.